From the patient side, you're never going to get full adoption, right? You're typically going to get a certain percentage of folks that like the solution and others don't. And this is especially the case in mental health care. There's so much heterogeneity in the symptoms that you have and the kind of solutions that you have. Some people want to talk in person. Some people want to do a chat. Some people want to read, listen to something, meditate. There's no one size fits all solution. So naturally, you have to come up with a solution that's multifaceted. In fact, our company didn't just have chatbots. It had a number of different other solutions, tests and games and audio and physical therapists and sort of like actual therapists that you could speak with and you could chat with as well. There were some populations where it was much more effective than others. And those populations tend to be younger, so tend to be more adolescents, sort of maybe like Gen Z, who were more accustomed to texting and who felt like they could talk about their mental health care struggles without their parents hearing, without having to pay for it. And this is particularly the case with more low income and vulnerable populations like more marginalized communities like LGBTQ community and things like that that couldn't openly talk about it. So you have a technology which is more confidential, you could resolve some of these issues. But when we applied the solution in the corporate setting, it wasn't enough. You had to do other things to try to keep folks engaged. You don't just download an app and then there's some incentives there. We had to constantly do additional things with the clients to engage them, whether those were webinars or group therapy sessions, and bring more and more content to keep it top of mind. Because at the end of the day, folks may use your solution, and in fact, they may stop your solution for a good reason. They got better. And so you want to make sure that the other folks that haven't had access also get access. And then on the side of the actual healthcare professionals, we made it very, very clear that we weren't substituting a therapist. In fact, we hired many therapists for our platform. We said we gave therapists superpowers. It gave them the ability to track symptoms when they weren't in the actual therapy session, because the chatbot would actually apply mental health questionnaires that were proven to be just as effective in measuring depression, anxiety, stress, burnout, or this measuring the risk of those disorders. It gave the therapist the superpower to provide sort of homework. So these are the things I want you to work on and note take. And so oftentimes they saw this as the next step of their profession. This was generally well accepted.